What's up, y'all? It's Dr. Casal. Today I want to talk to you guys about acne. What causes it, what you can do to treat it, and the things you can do at home before you go see your dermatologist and seek out help. Acne is one of the most common skin conditions that we treat overall, so if your acne is not getting better, please go see a dermatologist. Also, shameless plug, Dr. Shah and I just dropped a skincare book. Acne is part 3, chapter 1. So everything I cover in this lecture is going to also be present in that ebook, including many more skin conditions and many hero ingredients. So without further ado, let's dive right in. What causes acne? There are 4 main things that cause acne. Number 1 is abnormal keratinization. What this means is that the skin cells aren't growing properly. So if you look at skin under the microscope, it looks like a brick and mortar. Skin cells stack on top of one another and grow sequentially from base to surface. When inflammation in a pore starts leading to acne, the skin cells are growing aberrantly. They're kind of growing crazy. They're not growing normally like they're supposed to. So that's the first step, abnormal keratinization. Number 2 is increased oil production. So we have these glands in each pore called sebaceous glands. Sebaceous glands secrete a substance called sebum that's made of triglycerides and wax esters and a bunch of other things that cause your skin to be oily. Oil glands are stimulated by hormones known as androgens, and that's why we see an uptick in acne around the time of puberty. When kids are starting to get more hormones, these androgens are circulating around their body more. The third component leading to the development of acne is colonization with this bacteria known as C. acnes, Cutibacterium acnes, formerly known as Propionibacterium, say that 3 times fast, or P. acnes. This is a bacteria that lives inside of the pores, and what it does is takes the sebum, the oil, and breaks down the triglycerides present in sebum into free fatty acids, and that's going to lead to number 4. Number 4, probably most important of all, is inflammation. When these bacteria break down the triglycerides into free fatty acids, this leads to inflammation in the pore, which also causes increased abnormal keratinization. When all of these things happen inside of a pore, you have the development of a pimple or eventually full-blown acne. So what can we do to stop all these things? Each one of these steps can be targeted individually. So, for example, abnormal keratinization. The backbone of this is retinoids. Retinoids are vitamin A derivatives that bind to receptors in the skin and cause the skin cells to mature normally. Quick little aside, this is a really cool story. I learned this when I was a medical student. There is a condition called acute promyelocytic leukemia. So this is a cancer of the white blood cells in which basically abnormal white blood cells leave your bone marrow and go into your blood and wreak havoc. One of the ways you treat this is with all-trans retinoic acid. It's a retinoid. What vitamin A does in the body, and specifically in this condition, is it causes normal maturation of cells. So for this type of leukemia, it helps these immature white blood cells to mature into regular white blood cells. Very cool. But bringing that back to this, that's what it's helping your skin cells do too. It's helping normal growth and maturation of skin cells. Number 2, increased oil production. So increased oil production is a normal thing. We can target this with oral medications that block the receptor, the androgen receptor, like spironolactone. Also topicals like niacinamide can help with this, and green tea. Number 3, colonization with acne. So targeting and killing the acne-causing bacteria in the pores is one of the backbones of acne treatment. And that's why we often recommend benzoyl peroxide and salicylic acid, as both of these can penetrate down deep in the pore and kill the bacteria that cause acne. If you've ever been to the dermatologist or gotten a course of doxycycline or erythromycin, these are oral antibiotics that we also use to treat acne using the same mechanism. It kills this bacteria that digests the triglycerides, which form free fatty acids and leads to inflammation. One little caveat here at the end, isotretinoin or Accutane is the strongest medication that we have to treat acne in dermatology. And it actually works by targeting all 4 of these. So it decreases colonization with C. acnes, it decreases oil production. It's actually one of the only things that will actually cause atrophy or shrinkage of the sebaceous glands. and it'll lead to normal keratinization like we talked about. I hope you guys found this video helpful. If you did, please like, comment, and subscribe. Also, check out Dr. Shah and I's skincare book. The link's in the bio. Like I said, everything covered here is also covered in more depth in the skincare book, along with a bunch of other awesome goodies. I hope you guys like it. Enjoy. Talk to you soon.